everyone, I am Myra Justin Bitinor, and today I am going to demonstrate to you the procedure for assisting a patient with ambulation using cane. But before that, we are going to assess the length of the time, bed, and the amount of type of activity that the client can tolerate at the baseline versus range of motion of joints needed for ambulation, and the muscle strength of lower extremities and the client's medication and level of comfort. So since we are all set, we are going to proceed to the procedure. So for procedure number 1, review the medical record and nursing plan of care for conditions that may influence the patient's ability to move and ambulate. So assess for tubes, IV lines, incisions, or equipment that may alter the procedure for ambulation. This is to ensure the safety and not harm the patient during the procedure, and proper arrangement of groups may help the patient to ambulate. Now we are going to check the patient's medical record. So now we are going to proceed to procedure number 2, which is to perform hand hygiene. Put on PPE if indicated. This is to prevent the spread of microorganisms. Now I'm going to use an alcohol-based hand rub. So for procedure number 3, identify the patient, explain the procedure to the patient, tell the patient to report any feelings of dizziness, weaknesses, or shortness of breath while walking. So decide how far to walk. This is to give knowledge to the patient and to establish coordination to decide how much movement can the patient handle and to have adjustment. So good day, ma'am. I am Myra Justin Bitinor, your nurse for today. What's your name, ma'am? So kano sa birthday, ma'am? So today, ma'am, we are going to walk using a cane, ma'am. Kaya ba? So if you feel any dizziness or kung sa'yo magibate, report it immediately to me, ma'am, ha?
Yes, ma'am.
So for procedure number 4, encourage the patient to make use of a stand assist aid, either freestanding or attached to the side of the bed if available, to move and sit on the side of the bed. So this is to aid the patient in moving to the side of the bed. So now we are going to assist the patient to move. So, ma'am, akong ibutang ang imong feet there, ma'am, ha? And 1, 2, 3. So now we are going to proceed to the next procedure. For procedure number 5, wrap the gate belt around the patient's waist based on assessed needs and facility policy. This gives the patient greater feeling of security. So, ma'am, akong ibutang ang gate belt, ma'am, ha? Kaya ba? So for procedure number 6, encourage a patient to make use of the stand assist device to stand with weight evenly distributed between the feet and the cane. So this is to aid the patient's maintenance of balance. Now I'm going to let the patient hold it. So hold, ma'am, like this, ma'am. So for procedure number 7, have the patient hold the cane on his or her stronger side, so close to the body, while the nurse stands to the side and slightly behind the patient. So this is to provide maximum support and appropriate body alignment. So, ma'am, tabangan sa matindog, ma'am, ha? So 1, 2, 3, go. So for procedure number 8, tell the patient to advance the cane 4 to 12 inches. So 10 to 30 centimeters, and then while supporting his or her weight on the stronger leg and the cane. So advance the weaker foot forward parallel with the cane. This is to maintain the maximum support that is required for the patient's balance and safety. So, sir, so ma'am, akong i-move na to unang cane, ha? So next na yun. Okay, good. So for procedure number 9, while supporting his or her weight on the weaker leg and the cane, have the patient advance the stronger leg forward ahead of the cane. Heel slightly beyond the tip of the cane. So this is to aid the weaker leg and to feel the balance when moving. So, ma'am, padayon ta, ha? So, no? Okay, nice. So, for the next procedure, we are going to tell the patient to move the weaker leg forward until it is even with the stronger leg, and then advance the cane again. So the weaker leg should be the one to step last, since the stronger leg has more control in maintaining the balance, as what we have shown you earlier. So, ma'am, proceed lang ka, no? So for procedure number 11, continue with ambulation for the planned distance and time. Now we are going to return the patient to the bed or chair based on the patient's tolerance and condition, ensuring the patient's comfort. So make sure cold ball and other necessary items are within easy reach. So this is to let the nurse respond immediately when the patient needs something. So, ma'am, I want you to sit down. So, di lang, ma'am, ha? So, then I am going to remove the gate. I'm going to first remove this and the gate. So, ma'am, is there anything I can do for you? Tara, call the ma'am, if you need anything. So for procedure number 12, clean transfer aids for facility policy, if not indicated for single patient use. So remove PPE if used and perform hand hygiene. This is to prevent the spread of microorganisms. But before that, we are going to position the patient in a comfortable position. So, ma'am, balik na naman position. So now we are going to use an alcohol-based hand rub to prevent the spread of